Mike will be here in about 15 minutes. Well, actually, he'll be here in exactly 15 minutes. Martin, do you want to hold James for a bit? It's just that you'll be starting work soon, then you won't see him all day. Yes!
He's draining a brain abscess.
Good. Well, now we need a new breakfast. I know it's just shapes and movement to him, but I can't help worrying that those videos are going to make a lasting impression.
Let's hope so. This man's one of the best.
Really?
Concentrate.
You like that, don't you? Daddy'll play with you, won't you, Daddy?
I'll watch this later.
Well, that's the last of it.
It'll be a pleasant change to be around people again instead of animals.
Yeah, you're gonna love it round here. Everyone's really friendly. Morning, Mr. Moisey. This is Dr. Ellingham. She's your new neighbour.
Yes, I know.
She's Joe Norton's sister. She used to live on the farm.
Hope you haven't been knocking on my door till last.
I'm not that type of neighbour.
Good. If you're expecting pleasantries and small talk, you've got a long wait coming.
He's a grumpy old bugger. Ignore him.
Don't worry. I got the message.
So is everything all right?
Yes, thanks. It's ever so kind of you to let me have this room.
When you say let me have, I did mention...
No wonder Mrs. Tishel went a little funny on her own with her husband away all the time.
I'm sure I said...
If I didn't have friends like you, I'd go mad myself.
80 quid a week. That's what it'll cost you.
Yeah, you said.
Yeah. It's just for the bills and such.
Do you have a washing machine? Only I wouldn't mind.
In advance, if you don't mind. And cash wouldn't be refused.
Right.
Oh, right. Oh, yes. I've got a washing machine, and yes, you're very welcome.
Here we go.
Thank you.
Thank you. Better get going. Prescriptions to dispense.
Breakfast on the house.
Oh, thanks.
Good morning, Mr. Moisey.
I'm at the doctor's. What's good about that? I could have a terminal illness.
Thought you were just here for a checkup for your repeat prescription. Your nose is bleeding.
Oh, have you got a tissue?
Yeah, somewhere, I think. 2 seconds.
Today would be nice. Thank you.
Next patient.
That's you.
Thank you.
Don't sit there. Take off your jacket and sit there. Your nose is bleeding.
Yes, it is. I must apologise for going to the doctors with a medical condition.
Come here. Breathe in. Out. In. Out. Your breathing's very laboured.
I've got asthma. Had it for 50 years. You'd read your notes.
Roll up your sleeve. Your condition's obviously worsened. You experiencing any lightheadedness or fatigue?
Yeah. Well, once in a while. Think you could write that prescription, huh?
No. I won't be writing a prescription until I finish my examination. Your blood pressure's normal for a man of your age?
Well, this seems to have dried up now.
You had nosebleeds before?
Oh, well, once in a while.
Tilt your head back. Yes. The membrane's inflamed.
Well, I've got allergies.
Do you ever use over-the-counter nasal sprays?
Yes.
They can cause bleeding. You should stop using them.
No, couldn't you just done that the moment I came in?
No. Good day.
I'm not paying you for slacking.
Sorry.
It's good to see people walking past the window again.
Must have been lonely.
Sometimes.
I know what that's like.
Have you considered finding yourself a girlfriend?
Well, they're too busy.
I see.
I mean, I wouldn't mind. But, it's not that simple, is it?
Well, you certainly won't meet anyone with that attitude.
Take a seat. What seems to be the problem?
I got a lump, Doc. Hurts when I eat. I'm worried it might be the mumps.
Have you had an MMR vaccination?
Don't think so. I drove a woman and her kid to hospital last week. They're contagious, aren't they?
Any fever or aching joints?
No.
Fatigue?
I'm knackered. I've been working all the overtime I can get. Me and my wife saving for a baby.
Sure. Open your mouth. Morena, bring me in a lemon, please. Yes. The fruit. Yes.
The thing that worries me most is that it says on the web that 10% of men who catch mumps can't have kids. I don't know what I'm going to tell the wife. What do you need all that for? Why do you need a knife?
Stop talking.
All right, Stu.
Shut the door.
Thank you, Morwenna.
Bite that.
Oh!
It's not mumps. You've an infected parotid gland. Blocked by a stone, caused by a build-up of calcium, probably. When you bit on the lemon, it stimulated your saliva gland, which pressed down on the stone, and that's why it hurt you. Drink 2 glasses of fresh lemony water every day for the next 2 weeks. That should work its way out. If not, come back and see me. Spit it out.
Bert!
Right, it's just me.
Not next time.
Sorry.
I don't think it's too much to have a little privacy.
I forgot I had company. Force about it.
And a lock would be nice.
I'm right on it.
You take James to Millie's playtime at the library.
Oh, why don't you do it?
It was my head's meeting in Truro.
Oh, yes.
I know it's awkward, but he has so much fun there. And at this stage, it's really important for James to learn to socialise.
Yeah, he's 6 months old. I mean, I don't know how much socialising he's actually going to do.
But he needs to learn to interact, Martin. Do you want him to grow up to be shy and introverted? We don't want that, do we?
No.
Morning.
Morning. Whoa! I see you got a load of shopping in.
I hope you don't mind.
Certainly not. You make yourself at home. So is everything all right?
Absolutely fine.
Health-wise? All working nicely?
No complaints.
It's just that I couldn't help but notice that yesterday you had a needle
What?
in the bathroom.
Oh, right. Well, actually, I'm diabetic, but I don't really like to talk about it.
So, if you're diabetic, how come you got all that sweet stuff in the fridge?
Mind your own business. Right. Well, I better go and open up. The insomniacs will be hammering on the door, wanting their sleeping pills. I'll see you later.
I told him not to call you.
She could have been killed, Doc.
Can you see anything?
Hold still.
I don't have a concussion.
I'll be the judge of that. Follow my finger.
Oh, stop it, Martin. I don't know why Al even called you. I wasn't hit on the head.
Maybe you were and you don't remember.
Take my word for it, I'm fine. Aren't I, Martin?
Yes.
What you've got is a slow leak. The plaster has soaked up the water and got too heavy and joined you in bed.
Well, you need to call the landlord.
I can't get hold of him. Can you fix it?
No. The leak's coming from next door.
So?
Mr. Moisey's house.
Such a good little boy. We had a difference of opinion about breakfast. I lost.
Yes.
How's Ruth?
Surprisingly well. Fine, actually.
Oh, that's a relief.
We eat at this table.
Oh, it's fine, Martin. I'm in a hurry.
Where's the filter basket?
Filled basket.
Silver cup, yay big. Black handle so long.
Oh, yeah, it's over there by the carrots.
Well, what's it doing there?
It's shiny. Makes a nice noise when you bang it on the table.
Can we, talk about this Millie's playgroup thing?
No, Martin, you promise.
Surely it wouldn't matter if he just missed 1 week.
I'll finish getting him ready and tidy the kitchen, then go to my meeting in Truro. Mike will be here in a minute. You can take James to Millie's playtime for 1 hour at lunch. Yes?
Yes. Drink plenty of water. If your urine gets any darker in colour, then drink even more water.
Just a man. Do you have a minute, Doc?
No.
I've got a question for you.
Is it a medical matter?
Kind of.
Make an appointment.
It'll only take a moment. Now, I was wondering, why would a person inject themselves if they weren't a diabetic? Not with one of those pen things, but with a proper needle.
I'd assume they were ill.
And if it wasn't that,
I'd assume they were a drug addict.
could it be something else?
I don't know. I can't tell without examining them, can
If
I?
they did happen to be a drug addict, how could you tell?
Tremors, a slurred speech, mood swings, constriction of the pupils. I have patience.
Barbara Shue? Constriction of the pupils. Thank you very much, Doc.
Mr. Moisey,
You told me you wouldn't come knocking on my door.
Yes, and I'm sorry. The only reason we're bothering you now is we think that you might have a leak in your loft.
I haven't got a leak.
Well, can we come in and check?
No,
Why not?
because I haven't got a leak. I think I'd know if I had a leak. Now, leave me alone. If you knock on my door again, I'll call the police.
Who'd have thought it is playtime? I hope everybody's up for some fun and games. Now, who have we got here today? Oh, the dashing daddy.
No, I was just looking for the reference section.
Louisa said Daddy'd be bringing little Gorgeous today.
Right.
Come and join our gang. We don't bite, apart from Rufus, of course. Now, would Daddy like to introduce himself?
No.
He's Doc Martin.
That's right, he is.
Actually, it's Dr. Ellingham.
Oh, but we don't want to call him that, do we? That's so formal.
Well, we can't call him what we normally do.
We'll just call you Martin.
I prefer Dr. Ellingham.
Now, does any clever person here know what the wheels on the bus do?
I thought I warned you.
Hello, Mr. Moisey. Now, what's all this about you not letting Dr. Ellingham into your house?
Have you got a warrant? What? I'm not allowing you to search my house unless you've got a search warrant.
Oh, for God's sake, he doesn't need a search warrant.
That's right.
To search my property without my permission, you need a warrant.
Well, yes, you're right. I would need a warrant if there wasn't a danger to life and limb. But I'll have you know that Dr. Ellingham here was almost killed as a result of your leak.
I wasn't almost killed, but my ceiling did collapse, and we think it was caused by a leak in your attic.
And if you don't let them in, I will get a warrant, and you'll be in big trouble if you don't let them in when I get the warrant.
It's all useful, you know. I don't like to waste anything. Magazines could be turned into logs. Newspapers are very good for cleaning mirrors.
That's useful if you've got a lot of mirrors to clean, I suppose.
loft hatches there.
Well, we're gonna have to move some of this stuff to get the ladder up.
Well, as long as you put it back in its proper place. I thought you were supposed to be helping with the leak.
Right.
It's an awful intrusion. I do apologise.
Oh, just get on with it.
We won't be long, will we, Al?
Jordan by, I thought I'd pop in for a chat.
Oh, that's nice.
How are you then?
Not bad at all.
Good?
We got this sage oil in yesterday. It's supposed to help with rheumatism. It's from Turkey. Have you ever been?
You travel a lot then?
Oh, excuse me.
My boy Al went on his travels a few years ago. Some people aboard pick up some really nasty habits, don't they?
Really? Well, that is an interesting tidbit.
Here, just let me just have a...
Stop it, Bert. What are you doing?
Morning.
Morning, love. How can I help? It's a bit personal. Was that all, Bert?
No, not really. I'll catch you later.
Nobody likes me, everybody hates me. I think I'll go and eat worms. Big, fat, juicy ones, incy, wincy, squeezy ones. See how they wriggle and squirm.
When was that sock last washed?
This isn't a sock. This is Mr. Wiggles. Isn't Daddy silly?
No. We're going to leave, actually.
Well, you can't.
Yes, I can.
Well, we were just starting to enjoy ourselves.
Oh, no, we're not. Yes.
Right, everyone. Oh, nobody likes me, everybody hates me. I think I'll go and eat worms.
Yeah, it's coming from the water tank. I've taped it up. We're gonna have to get someone around to fix it.
I will.
Shall we give you a hand moving some of this stuff back?
No, I can manage. You can go. Now.
Okay, now. This is the moment we've all been waiting for. I want everybody to... This is how we learn to interact and how Mummies and Daddy make new friends.
Hello. Trace Hannerford. You probably don't remember me. I'm one of your patients.
You have a yeast infection.
Oh, my God. You can't say that out loud. What's going on here? Looks like the big people need a lesson from the little people. Have you got anything you want to share with each other?
Not in front of the kiddies. Actually, there is something I wanted to ask you about Shona,
About what?
my baby.
Yes?
The thing is, she isn't really grabbing hold of things. Shouldn't she be doing that by now?
Infants develop at different rates. Child's probably just backward.
What? Jeez! Just capturing the magic moment. Oh. Well, it's nice of James anyway. Hello.
How did it go at Millie's playtime? Did he enjoy it?
Yes.
It's fun, isn't it?
Why does everything have to be about having fun?
Is that why you've taken his toy and given him a spoon to play with?
He's enjoying it just as much?
Really?
We should put all these into his bedroom now he's not sleeping in ours.
But really, you'd prefer it if he didn't have any toys?
No.
So are all of your friends going out with someone?
You mean apart from me? That's why I'm sitting here watching telly with you. Cheers. No, I just happen to be a bit more choosy than my friends.
No, I mean, are any of your friends available?
Oh, right. Have you tried the internet? Cornish couples is supposed to be good.
Yeah, I don't think, that's for me.
You could always put up a photo from when you were younger. I could ask around if you like.
Nah. Well, you could, if you felt like it.
Janice is about to dump Gary.
Jenny, are you on drugs?
What? No.
Then why are you wearing that eye patch?
I told you yesterday because I got something wrong with my eye.
Let me have a look.
No.
Aha.
What's that supposed to mean?
Well, that is all the proof I need, that is.
I am not on drugs. I'm hiding my eye because it looks horrible.
Oh, really?
Oh. All right. I'll show you, just to shut you up. And you got to promise not to pull a face, all right?
I promise. Ooh.
Well, that's a face.
Well, what happened to it then?
I don't know. I'm probably just a bit tired or something. Does it really look that horrible?
No. Not really, no.
Honest?
Mr. Moisey, are you all right?
Oh, yeah, I can manage.
Are you sure?
No, it's just a bit dizzy. That's all.
Are you sure you don't need help?
No, I don't.
I bet James will grow up to be just like you.
Be quiet.
Millie dropped this picture in for Louisa.
What's that doing here?
I've got an official request concerning your canine. Can I have him for a bit?
It's not my dog.
Well, technically, you inherited him from Joan. The thing is, I'm planning on bringing our department into the 21st century.
Just get it out of here.
Right. I'll take that as an affirmative. Don't you want to know what his job's going to be?
Of course I don't.
Sniffer dog.
Oh, he's good at that.
I'm early.
Go through. Not there? Sit there. Yes?
Well, I've had more of those nosebleeds. You said they'd go.
I seem to remember advising that you stop using the nasal sprays. Is it safe to assume that you didn't?
No, I did. And, I've been having some dizzy spells. I feel like I've been run over by a bus.
What does that mean? Be specific.
My joints ache.
At night or during the day?
All the time. Agony.
How long's it been going on for?
Too long. A couple of weeks.
Well, why didn't you tell me about it when you last came to see me?
Well, I thought it would get better. It got worse.
Which joints ache the most?
All of them.
Does that hurt?
No.
Have you had a fever recently?
No.
Is there a history of joint pain in your family?
No.
You had any sort of infection?
No.
I'll prescribe you a course of anti-inflammatories. That should help with the pain. And make an appointment to come back in 5 days.
What happens if I drop dead before then?
Then we'll cancel the appointment.
You are now officially a representative of Her Majesty's Police Force. Now, I want you to imagine that this is, in fact, an escaped criminal. Now, it is your task to stop. It could be armed, but just a sniff. Now, it's your task to track the felon down. Stay. No, wait. Stay. Stop! Wait! You're aiding and abetting!
Get the criminal!
Of course, that would have been 1955. Now, takes me half hour to get up the hill.
Yeah.
Frank used to say, that hill is steeper than it used to be.
Joke.
He didn't have much of a sense of humour. Anyway, Frank's not with us anymore.
Oh dear.
Not many of us left now. Scared to pick up a paper in case I see myself in it. You youngsters don't know how good you have it, skipping round like larks.
I know.
I'm on the way out myself.
Next patient.
Go on, Mrs. Eddie.
Count myself lucky to be here at all. Don't run off. Might as well book the buffet now. I take it you haven't seen too many as old as me, which would account for why you're staring.
Take a seat.
I shall be dead in a few months.
What?
I just want you to confirm it so I can make my arrangements.
Why do you say that?
We got a medical dictionary. At the tea club, we all chipped in.
I see.
Got a melanoma under my arm. The right one.
Fine, sit on the chair.
I can see it.
Take off your jacket.
These buttons might take a few minutes. Medical dictionary said it's a dark pigment melanoma.
Did it? It's a raised lymph node. You've got an infection.
So why is it black? You ought to know that.
Yes, I know what the phrase means. The tattoo is infected. That's why your lymph node is enlarged.
It has a dark pigment. It's a melanoma.
No, the ink has entered your lymphatics and accumulated at the node.
So it's not a melanoma.
No! The infection's most probably caused by an unsterilized needle. In future, I suggest you use a different tattoo parlor.
Oh, them places are for teens. We bought an ink gun off the internet.
Who's we?
Me and Ethel. 80 quid on eBay. Tattooed each other. Oh, Ethel were a right wimp about it, though.
Well, tell Ethel that she needs to come and see me as well.
Tell her yourself. She's through there.
Ethel,
Can't be me.
show me your tattoo.
What?
Now, please.
Oh, which one do you want?
You've got more than one.
Joke. Ow!
Do you want me to help?
No,
Bully.
it's infected. I can't believe what you two have done. Even properly applied tattoos can cause skin conditions. Not to mention carcinomas, hyperplasia, and vasculitis.
Well, we like 'em.
Good, because they're permanent. I'll prescribe you some antibiotics for the infection.
Like what you see?
How long have you had that?
What?
That ulcerated lesion on your neck.
I don't know.
It's a rodent ulcer.
What?
I'm not surprised. Her place is a tip.
It's caused by exposure to the sun.
Oh, it's not cancer, is it?
Yes, it is. It's not invasive. I can easily remove it.
Oh, what you waiting for?
Right?
I'll have a cup of tea while I'm waiting then.
No, she won't.
Al? Yeah. There's nothing wrong with Al. What's wrong with him?
Well, he's Al for a start.
He's got a good sense of humour, though.
I'm not sure I fancy spending an evening with him, no matter how good his jokes are.
Oh, come on. He's a nice bloke.
Yeah, but...
Yeah, but what?
What if it worked out?
Yeah?
What if we went out, got to know each other, and got married, and I ended up really loving the guy? Where would I be then? I'd be married to Al, wouldn't I?
There's Daddy. There's James. Just because Daddy isn't smiling doesn't mean Daddy isn't enjoying himself. Look, Millie dropped this round.
Yes, I know.
At least James looks happy. It's just not a very flattering angle. Morning.
matter how many times I look at it, it still makes me laugh.
Find this Trace woman and tell her to bring her daughter in.
Can I take my coat off first?
Tell her it's urgent.
And good morning to you.
Morning. I think you've had a stroke.
What?
Well, your eye been all peculiar like.
I don't think so.
I googled droopy eye, right, and it's either that or you've got a brain tumour.
Stop going on about it.
You are going to see the doc as soon as you had your tea and toast.
He's got bigger fish to fry than me, judging by some of the prescriptions I've had to fill out. The stories I could tell, but pharmacist's oath and all that.
Jennifer, you'll see the doc and you'll see him today, even if I have to carry you on my back.
Mr. Morrissey! Mr. Morrissey! Mr. Morrissey! Are you all right in there?
What's this all about then?
Take a seat. I need to examine little Sheba.
Shona?
Yes.
You've thought of a new insult for her, is that it? What are you doing? What's wrong with her?
Look at this photograph. Look at her eyes.
Why? What's wrong with them?
One's red, the other one isn't.
So, isn't that just red eye?
Yes, exactly. So something is stopping the flash from reflecting in the retina of the other eye. I think she has a cataract.
A cataract?
In the left eye.
She's too young for that.
No, she's not. Infantile cataracts are rare, but fixable. She'll need an operation to replace it with an artificial lens.
She'll be all right, though, yeah?
She'll need a checkup every 6 months, but, yes, complications are rare. I'll make an appointment for you at the ophthalmology unit in Truro.
Thanks.
You're welcome.
Mr. Morrissey? Penhale! Come and help me get this stuff off him.
And try closing it again.
Give me a moment. I can do this.
You're sure you've no idea what might have caused this?
No, it was like this when I woke up.
There's a puncture mark on your forehead.
Strange. Must be a mosquito or something.
Frown.
Okay.
Frown. Like this. Come on.
I am frowning.
You stupid woman.
What?
You know exactly why your eyelid's drooping, don't you?
No, I don't.
You've had Botox injections, haven't you?
Well, I've done it before, and it's always been all right.
You did it yourself. You self-injected a potentially lethal material into your system with no medical training whatsoever. You're an idiot. You've completely relaxed the muscle that holds your eyelid.
It will wear off, though, won't it?
Yes, in time, but until it does, you run the risk of your eye drying out and ulcerating.
Oh, I didn't think of that.
No, of course you didn't. Now lie down on the examination table. I'm going to perform a lateral tarsorrhaphy. Close the lids up and stop your eye from drying out.
You're going to operate?
No, I'm going to use superglue. We don't stitch them anymore. It's a standard medical tool. Next time you feel inclined to inject poison into your system, please find a qualified practitioner to do it.
Would you be prepared?
No, of course not. And when the Botox is worn off, I'll remove the glue and your eyes should operate as normal. What?
Doc, Ruth needs you. Now.
Are you sure you're not in pain?
Doing worse than usual.
Look, we've just pulled you out from under a mountain of newspapers. The least you could do is be polite.
Sorry.
Is this your wife? She died? How long ago?
Couple of years. Well, my sister died about the same time.
Not long after that, you found yourself unable to throw anything away.
Yes.
Put the tea on. Couldn't find a kettle. Then, of course, 3 turn up at once.
Thank you, Penhale. Let us know when it's ready.
Next to the kettle was what looked like a mummified cat.
Penhale,
Yes?
please.
Oh, right. Yes, I'll go and do those things.
Well, I'm sure some of this stuff is useful.
I could find a use for anything.
Your wife?
She never wasted a thing.
So you lost everything in a short space of time. After that, you couldn't bear to throw anything away, could you?
Egg boxes, glass jars, elastic bands.
What's happened?
Well, I had a dizzy spell and then everything went dark.
What do you mean, you lost your vision?
They're buried under an avalanche of newspapers.
And when did you last eat something?
Breakfast?
What, spaghetti hoops?
Well, Eleanor did all the cooking. I never learnt properly.
Do you only eat tinned food?
No fruit or vegetables?
I don't like fruit and vegetables.
Unbutton your shirt.
It's okay. Everything's under control.
Idiot. You had any chest pain? What are all these bruises?
Well, some of the cardboard boxes are very heavy. Some of them fell on me. What are you doing? I'm not a horse.
Stop talking. I need to look in your mouth. Yes, your gums. They're all raw and bleeding.
Oh, for heaven's sake.
Yes.
Don't panic. I'm all right.
What is it?
You've got scurvy.
I didn't know you sailed, Mr. Moisey.
It's a vitamin C deficiency, Penhale. The consequence of sticking to a diet with very little nutritional value.
I didn't know you could get scurvy in this day and age.
You'll need regular doses of ascorbic acid, fresh citrus, and vitamin C tablets, and stop eating this rubbish.
It could be that Mr. Moisey's depression led to a lack of interest in food and therefore to his illness.
It's also possible that the illness led to the depression.
I am here, you know.
Shush.
Well, either way, the man is depressed. Mr. Moisey, you need help. Martin will refer you to a qualified practitioner. Won't you, Martin?
Yes.
Drink with the lady?
For the stupid old fool, you mean?
I don't think there's any cause for you to go on injecting yourself with that stuff. Here's to a fine-looking woman, if you don't mind my saying so.
Well, I was once, wasn't I? A long time ago now.
It's enough of that talk. You're the best-looking pirate I've ever seen.
You still look at me the way you did all those years ago.
I think I always will.
Well, they do say that beauty's in the eye of the beholder, right?
And I like what I see.
Thank you.
Dinner's in a few minutes.
Yes, I'll be right through.
I did. I drew a booty cat as plain as he could be.
Here's Daddy. I'm making making the sauce with the anchovies, but I'm leaving out the anchovies.
Thank you.
Sir is my name. I only have one.
Oh. Trace from Millie's Playtime's actually saying quite nice things about you now. I still need that.
Oh.
And I've just tidied those things away.
Sorry.
Look, there's no point, Marston. It's only going to get messy again.
You should clean as you go.
Oh, really? Should I? Martin, those don't go over there.
Yes, I know. I was just...
Right, Martin, why don't you just sit down and give James his supper? He'd like that.
Hiya. I took these home with me to iron. I wanted to watch the cycling on satellite.
Oh, thanks, Mike. That's great. Just pop over there.
Right,
Martin, do you want olives?
No, thank you.
Oh, I've made a list of what you're running low on. Baby wipes, bath wash, cotton wool, Q-tips.
That's great. Just pop them over, guys.
And for an